often asked by patients who come in for consultations to address only their neck problems. This is where a neck lift procedure is ideal. The difference between a neck lift and a lower facelift is simply that the neck lift only addresses the area below the jawline. A lower facelift addresses the area above the jawline as well as the neck itself. It's a more extensive procedure in terms of the areas of solution, but like I tell many patients, taking care of problems in the lower face is about balance. You heard me talk about patients who come in for a neck lift earlier. Well, many times addressing just the neck is going to give them a great neck result, but it's going to draw out the problems that happen along the jawline. And I have had patients who are very adamant about only requesting a neck lift, and we perform a neck lift on these patients, and 3 to 4 months after the procedure, they wish that they had had the jawline issues resolved because those issues now come to the forefront. So the majority of the time, or for the sake of balance, we recommend having a lower facelift versus an isolated procedure, simply because most patients not only have a neck issue, but most patients also have a problem along their jawline, such as jowling or marionette folds or those kinds of things in the lower face. So the lower facelift, as we call it, is usually the indicated procedure in this practice for most patients. The typical physical recovery is 14 days. That means that a patient at 14 days can go back to full unrestricted activity, including the gym, at 14 days after surgery. This is when I tell all of my patients, you can go back to life, pretend you never had surgery, and go back to doing whatever you were doing before surgery. So it's that social recovery between 7 to 10 days, and then the full recovery takes place at 14 days after surgery.